So more recent advances that we have for these patients who have failed the covalent BTK inhibitors would include non-covalent BTK inhibitor. The one that's currently available is pirtobrutinib, or Pirto for short, and that's a first-in-class, a highly selective non-covalent, reversible BTK inhibitor, and it does inhibit both wild-type and mutated BTK, and has been used in this patient population quite successfully. Has favorable oral pharmacologic availability and can be easily administered. It does have reduced off-target effects, and therefore the toxicity really is quite low, and patients often tolerate this quite well. There's also in the US 2 available CAR T-cell therapies for patients with relapsed mantle cell lymphoma who have failed the BTK inhibitor, and they are currently available. They both have fairly high efficacy, which we'll go over in a minute, and of course toxicity of CAR T-cell. We all know that the potential for cytopenias, infection, CRS, and ICANS or neurologic toxicity are there as well. There's manufacturing, there's the cost, there's the availability, so they, although available, are perhaps not available to all patients. More recently, bispecific antibodies have been in clinical trials for this patient population. There's currently no specific approval. However, it is mentioned in the NCCN guidelines in the United States, so sometimes we can get this for patients in the US. It does have a small rate of cytokine release syndrome and neurologic toxicities, does have a infrastructure necessary to deliver this, but potentially in the future this may be available to this patient population.